Hello out there in the virtual world. My name is David McVeigh, Product Manager for Visual Smartboard with iAtcher Systems. Coming up, you're going to hear a recording of an interview with Nan Till, Natalie Kennedy, and Jamie DiLorenzo from Saratoga Hospital, which took place on April 9th, 2020. This vital IT team generously gave up their time to share with you how Saratoga tracks COVID-19 with Visual Smartboard. The demonstration you will see utilizes test data, but shows functioning boards. To share perspective, Saratoga Hospital is Saratoga's region's leading healthcare provider and the only acute care facility in Saratoga County. The hospital's multi-specialty practice, Saratoga Hospital Medical Group, provides care at more than 20 locations, ensuring easy access to programs and services that can have the greatest impact on individual and community health. During the more than 120 years since founded, Saratoga Hospital has remained true to its vision of its founders of keeping pace with the changing needs of the community to ensure its continued good health and exceptional quality of life. I understand that you have an outside tent to test and identify COVID patients. Can you tell us about that and how you're using a smartboard in the outside setting?
Sure. This is Nan. Like a lot of other hospitals, at first we didn't know even where to go with this COVID pandemic, and knowing that we really didn't want patients walking into the hospital or our urgent cares, who were possibly positive, we decided, like many other hospitals, to create these tents outside of our emergency department. The patients also might have visited their primary care provider, and now they are also questioning if they're COVID positive or not. So we really needed a way to track these patients that we were sending these swabs down to the lab to have the COVID testing done. So we created just kind of a simple smart board that the schedulers will get that information from the patient, and they'll schedule a time. Our hours have changed, and they've gotten a lot more proficient, so they're seeing a lot more patients in like 10-minute increments in the tent now. So our first smart board really was just a way to track these patients the day that they were coming. They were scheduled for the time, their name and their contact number, and then they're just using these a CDS attached to these columns here, just knowing that they've gotten the order or they've gotten the information that they needed to get prior to the visit. So they're using this in the tent the day of. So if it's the current day, it's just purple. Once they're registered, they fall off the smart board. In live, you'll see we have lots of patients for the current day, and then future dates on the smart board as well. So they're really just using this to track that the order was placed and what patients that they're going to see. It just has been very helpful in knowing that they've gotten the information that they need and who they're going to see in the tent.
And can you tell me just a little bit about how long it took you to create this board and get it into production?
Yeah, this was relatively easy because we have so many smart boards, and so I would say within a couple hours it was written. We had the CDS attached, and it was pretty much put out there for users' access. And the lab was so thankful to have something to work off of. So it was pretty quick turnaround time.
Excellent. And so when you started creating these boards, what did you ultimately hope to accomplish? And do you think that those expectations are being met, the expectations that you had?
Oh, yeah. It changes constantly, as I'm sure anybody that is in healthcare now. At first, we weren't even, there was so many orders of testing that we only really were scanning in the results when they came back from our Wadsworth lab. We weren't even putting the results into lab because there was just so many they couldn't keep up with. And they literally had expanded staff to scan these results in. So, what our thought was originally it just seemed to change by the hour or by the day. So we just continued to either tweak the current smart boards or to write new ones, to accomplish what the goal was, which is so nice with the smart boards, is that you're able to do that. And, it just means everything to the staff that's actually using them. So some of the smart boards, as we get into them, you'll see that some of the results were from the scanned document. So they originally had to go into that document to actually read it to find out what the result was. And then later on, we started to get staff to enter the results. So then we were able to write another smart board that would pull those results in, and we could color code them if they were negative or positive. So that was a big help there.
So you mentioned tracking positive and negative patients. Are you doing that with the admitted patients, I assume? And how are you doing that?
So this one was originally created for our outpatient care managers who were doing the phone calls both to the provider and to the patient. So what this is pulling is, their account information, name, their phone numbers, so that they don't have to go digging for it, who placed the order. This lab reference date is actually the date that the result document was scanned into the system, since, as Nan said, we didn't have those results being entered historically right away. So they were going back and linking to the scanned forms at the top of the smart board to see those results before they made the phone call. And then this call to provider, date, provider notified, call to patient, and date is actually linking into a nursing documentation assessment. So that way it's all stored within the patient's data record, as well as not just available on the smart board, so that we have a way to run reports and, see who contacted who if it's necessary. So if you go into, COVID-19 calls, it's very simple. We do have a result field in here. They just wanted to document what they were giving. We're not posting that to the smart board. That was by request of the outpatient care managers. They weren't sure necessarily who would be looking at the board and really just didn't want that visible on this particular board. But that's where we're documenting the phone calls made by them. So that's really what this one is for.
That looks really good. Transitioning a little bit from more of the admission side and some of the information you've showed us so far, transitioning over to the pharmacy, what boards have you created from a pharmacy perspective to help with the COVID-19?
Well, I created just pulling the results from the COVID test, the positive or negative. Originally, we have a MedRec team that consists of pharmacists and pharmacy technicians, and they, were concerned with patients in the beginning coming in, and they weren't aware that the patients might have been COVID positive. So they wanted a way to be able to recognize these patients, even if the ED patient had departed. They wanted to see whether the result was positive, so they could see if they actually went into the room and might have been infected with the virus. So this board helps, everyone involved in the patient care easily know the patient's status. So they were more efficient with how to proceed with the PPE. In the beginning, I kept the departed ED patients on there and the discharge patients so that the pharmacists could see, when the result came back, and if they were positive, they knew what precautions to take. Right now, our processes have changed because everybody is really wearing PPE now. So this is really for the pharmacist to know who's positive and what the process will be. We also have pharmacists that are decentralized, so this way they can see which patients on the floors are positive and they know what precautions to take. And it also sees how many cases are positive, and it reinforces the need for proper PPE and social distancing.
All right, I was just going to say the inpatient smart board. this is based off of the result that they are entering now into the lab. So, red just meaning that it's positive, where this one is from the old way of scanning this in. So you can see that, it was a lot better when they actually started entering the result, because we were able to pull that result, where you're actually seeing it from the smartboard, as opposed to having to hover over something or going into the scanned document.
Yeah, in the beginning, when they were scanning in the results, I had the board, I just had the pharmacist look at the lab status. So if the status was completed, they knew that the result was scanned in. But now, everything's changing, as you know, so now the results are put in, which makes it a lot easier for the pharmacist to know and don't have to go search for the scan result to see what the result was on the scan report. It's just time consuming.
Nan, will you click into the SIP MedEnt board?
Sure.
So this is what our Saratoga inpatient physicians use. And this is a board that they actively use all the time, every day. All I did to this one was add the COVID positive and negative. So that just shows the test. And then if it's green, it means it was negative. If it's red, it means it was positive. And then if it's blank, the result hasn't been entered within the system. So this is really just a visual for them to know quickly what ones of their patients, when they were already using this tool, to see what ones are positive.
So you mentioned tracking orders for COVID-19. Do you have a board that's actually tracking that for you? Are you adding that to one of your existing boards? How are you tracking the actual orders related to COVID-19?
Actually, this one, normally the order is actually in live. The order is actually here. We attached the order to the scheduled appointment. So as soon as, for 10 patients, as soon as they're scheduled to go to that location, the order will actually be placed, and it actually appears on the smartboard. And we looked at this morning and realized, I don't know why they're not coming over and test, but normally the order is there. So, the only just issue that we have now is just for the inpatients, where, especially if they're coming up from New York City, we know they're coming up because they're COVID positive, but we have not placed another order in our system because there's no need to. So we need to identify them better.
So you've mentioned a few times that the COVID-19 situation, especially when it comes to tracking and what's necessary on the smartboard, has been changing pretty quickly, and it became pretty evident that tracking employees as well as patients was going to be necessary. And I understand that you have a board that's tracking employees and things that relate to COVID-19 as well. If you could talk just a little bit about that.
Sure. So our employee health department, there's about 15 staff members that are tracking these, and there's a lot of concern about patients that are exposed to positive patients, and then we have all these employees that now have to be tested. Either they're showing signs or the hospital is testing them just to make sure. So they have been using a spreadsheet with all these different tabs by location, and if we had a practice that was exposed, we had every single one of those employees tested, and they needed to track, if they ordered the test, if it was more flu-like and they really weren't showing those symptoms, or if they did have to quarantine them, when did that quarantine date start? When are they going to be able to come back to work? What day did they go out of work? So there was just a lot of things that they needed to track, and they weren't doing a really good job with it, and they were crashing the spreadsheet, and it just wasn't good. So they came to us and said, is there anything that we could do from a smartboard perspective? So, these are not patients. So the only way that I could really work with employees was to I added this to a payroll screen in, it's just the sensitive, confidential payroll screen that gives the employee employee health access. Essentially, they use it for employee vaccinations and stuff that they're doing yearly. So I added a screen specifically for COVID tracking to each, to the CDS for payroll. And then they go in and they add that employee as somebody that either is, had, either if they're flu-like symptoms, they're kind of just like over here and they don't really, there's nothing really more that they need to track. If they determine that they do need a COVID test, everything is very color-coded, maybe too much, but that's what they wanted. So, if it's positive, it's color-coded here, the date it was ordered, what the results came back was, that they were notified, and then their quarantine days, they're actually entering a payroll as well, their start date, and then the review date, which is one of the things that they were really having a problem with because there's so many patients now in the Excel spreadsheet that they didn't know when somebody was up, and they had to call that employee, see how they're doing, if they're ready to come back to work. So, just by the simple color coding, if it's 14 days past their start date, then, they need to, contact them so it turns purple. I did a WebEx with the managers the other day, and they were very excited to be able to do this from, one source like this. And then when they're done, they're just going to remove them from the smart board. So I think hopefully it's going to work a lot better than their current process.
Well, I think they look really great, and the color coding is just fine by me. You did just mention that some of the smart boards are more complicated when it comes to creating the pieces that are necessary, and some are very simple. Do you have any best practices that you use that you'd like to share with other visual smartboard users that might view this and want to build something similar?
Most of these fields were just queries from a CDS, so they're pretty easy to put on a smart board. So really, it was a lot of the tweaking that I had was, really the color coding and, what they wanted things to say. But they love the hovers, otherwise, you'd have a column for each one, or, you'd have rows, you'd have, 4 rows to each employee or something. So, when we get stuck, we certainly aren't bashful in going for help, but we certainly have gotten better over the years as well. And our hospital rely on these smart boards like they rely on our MedEnt system or our Meditech system. And really, I don't know how we would function. We've said this before. It's like if we have new employees that come in, this is the front end of what they do. And they don't really, some of them don't even really understand Meditech, or they think this is Meditech, but it's because this is all they know. They're not, they weren't here prior to us using smart boards where they knew to go into admissions and go into number 10 and then number 15. When you have kind of a one-stop shopping from the smart boards, and they have the links that they can just link to the applications that they need to on the top, it is just such a help. Right, girls?
Yeah, even our volunteers use the smart boards to see who is currently in-house. So when someone comes up to the front desk, they know immediately if that person can have visitors. So I forgot to mention that. We did that for COVID. We have very severe visitor restrictions in place, and we added to the volunteer smart board. I think there's only 1 or 2 right now that's allowed to have visitors, and that's very visible to them. So yeah, we rely on these massively.
Yeah, our pharmacists rely on the boards constantly, just with drug monitoring, even for the COVID drug use too, which I forgot to mention, but they rely on it all the time.
We appreciate you taking the time to listen today and hope it is helpful for other hospitals and health systems to learn how data can be customized to gain more visibility to COVID-19 with the ability to give their providers access to the information they need most. We appreciate Saratoga Hospital's IT team sharing the hard work of all Saratoga puts forth to combat the virus and provide superior patient care to their patients.